If someone wants to go on that side, hyaluronic injections are there. Can you tell
Yeah,
a
so
little
those
more
work,
about that?
yes.
Yeah.
So those are called skin booster injections,
Yeah.
or even comes in filler. So hyaluronic acid can be used in different cross linking with a different kind of viscosity for different requirements and for different indications. So there are certain skin booster injections that we give where small amount of hyaluronic acid is deposited with very tiny needle just in the dermis, in the lower layer of the
Correct.
skin. So therein it attracts water and tends to hydrate the skin for a longer period of time. So it gives a little bit of a glow. Even as to the skin, yeah, that definitely works. That
A
can
lot
be
of
done.
people are very scared about these things. Can you tell them it's safe and it doesn't have any side effects? As
Yeah, so
I think they go for a good 6 months and you can
yeah,
refill.
6 to
take
8
them.
months it
Yeah.
does work, and it gives a really good result. So especially somebody who has uneven skin tone or who has dry skin would really benefit from these skin booster injections. They are safe when you go to an expert and get it done. Make sure you're visiting a dermatologist to get these procedures done. Yes, it is safe and you will like the results.
I have one another question to that. Does the doctor also treat herself or with these treatments,
Of
or
course.
they're
Oh, yes,
okay?
yes. Of course, I do get skin boosted injections on my face.
Oh.
I do get anti-wrinkle injections on my forehead and around my eyes. From time to time, yeah, all
And
dermatologists
is
do
there
it.
a particular age to, if, for example, I'm 29, if I'm scared I might get wrinkles here, when can I start?
Okay, see, so different dermatologists approach it differently. There is something called preventative Botox. I'm not a big fan. If you have hyperreactive muscles and if there's hypertrophy, and I can see that the muscles are overused, then you can use a little bit of botulinum toxin injection into that area to soften it. We don't want to freeze your face, but just soften it a little bit. That can be done in your 30s. Okay, and otherwise, other treatments depends upon your facial structure. What is your expectation from treatment? A little bit of lip filler can be done even in your 20s. That'll just give a little bit of hydration, kind of balances out your profile, makes you look a little, a more balanced facial feature. That's what we tend to achieve with fillers. There's no age as such, but yeah.
But they're safe for every age.
Yes,
whenever
they are
want.
safe. They are safe. Again, qualified professional, let
Of
them
course.
assess it and take a decision. Then,
But do you
if
think
done judiciously, it's fine.
earlier the better? Like if we go and prevent them from
Rather than cure.
rather than cure.
Okay, so see, there is
Prevent or
something.
how
cure.
does it work? We very
Okay, so with botulinum toxin, we do have a little bit of observation that if you start too early, then it tends to make you look a little more aged because the muscles become atrophied. The muscles become thin. Okay, so
Correct.
that can then make you look a little more aged. So I would not suggest you to overdo with botulinum toxin injections. You have to use it judiciously. If you feel that certain muscles are overactive, maybe you can just do those, and maybe even though the results last only for about 4 to 6 months, don't get them done before 8 months to a year. That is something that can be done so that the muscle action comes back and then you again re-inject rather than going every 2 to 3 months to inject it.
so it's
So that
better
is
to
something
get
you
it
can
done
do.
when you see something on your face.
When we suggest that when you start seeing slight lines and wrinkles that remain on your skin, even when you are not moving your facial muscles, very slight faint lines, that is the best time to get it done because that can be reversed and that can
Okay.
be improved.
But coming back to, for example, I want to get it done and experience this just for the experience sake once.
Yeah.
I get it done and after 8 months it gets faded away. Is it a loop to getting it done or
Not
an
at
addiction
all.
to get?
No. So yeah. So this is a good question, because a lot of people feel that, especially not with Botox as much, but with filler, they feel that, oh no, when the filler gets dissolved or goes away, disintegrates, then will I look older? Will it make my sagging worse? No. You see what happens when a 40-year-old gets filler and Botox done. She'll start looking like 32, 33, 34. Okay, so you tend to look 5 to 6 years younger. Then when it fades away, you
You're
will
again back at
look
40.
42, 43, but you're used to looking 35. So, suddenly they start feeling, oh,
That's
it
what
makes me look
you
worse.
That-
get
It
into
makes
the
you look
loop
worse.
then.
It doesn't make you look worse. You just tend to forget what you looked before you got these treatments done.
That's
I'm
true.
not trying to encourage, and I'm
Of
not trying to
course,
say
Absolutely.
everybody
and
should go and get it done.
everyone wants
Okay?
to look young at
I
this
think
point
this
Yeah.
is a
in time.
choice, complete
Absolute
choice.
choice. If you like your wrinkles and you embrace it, go ahead. But
Yeah.
there are modalities available if you want to embrace it. If there are modalities available if you want to correct it, so definitely do it judiciously with an expert, and you should be happy with the results.
Can
Correct.
people do something like this for acne or adult acne? We've got so many questions on that. Like some, can they do something for acne or reducing dark spots or acne spots? Is there any treatment for that
Oh,
also?
absolutely. There are many treatments for acne, adult acne. So, see, you have to understand that adult acne is usually the cause is hormonal. So, we have to take a detailed, menstrual history and also what all medications are they on. Is there something that is triggering it? Sometimes even, use of makeup, not using the correct skincare products could be triggering. So, all that has to be considered and taken into account because hormonal acne or adult acne is not something that you can just apply some creams and it'll go away.
Yeah.
Usually, it requires oral medications also to be taken for about 3 to 6 months. But yes, there are lasers available which can reduce your dark spots and reduce acne. There are chemical peels which we prefer to do along with creams. So yes, there are multiple treatments available for acne and acne spots. So yeah.